So plantar fasciitis is the most common condition affecting people's feet. 6 million Americans suffer from plantar fasciitis a year. It's a condition that involves pain and inflammation of the plantar fascia, a bowstring ligament that extends from the ball of the foot to the heel. So every time you stand, you bear weight, your foot flattens, your arch collapses, and you could develop micro tears of the plantar fascia, which could result in pain and inflammation in the arch and the heel. These symptoms are most commonly occurring either in the morning when you get out of bed or after long periods of rest. So I recommend 6 steps that can help resolve plantar fasciitis pain at home. The first step is to stretch 5 times a day. I tell my patients to stretch every time they brush their teeth, every time they have a meal. That way you can incorporate it in your day-to-day routine. It's important that you stretch both the Achilles tendon and the plantar fascia. The culprit of plantar fasciitis is often a tight Achilles tendon. So you could stretch the Achilles tendon by sitting on the floor, extending your leg, taking a towel, a TheraBand, or belt, putting underneath the forefoot, and stretching the Achilles tendon by bringing your toes towards your nose. The plantar fascial stretch could be done by sitting on a chair, putting the affected foot on the opposite knee, taking the same side hand, bending your toes up, and then with the opposite hand, massaging the arch with your thumb by compressing and kneading in a circular fashion to help break down all the scar tissue. Tip number 2 would be to ice the foot. You could do this by getting a bottle of water, freezing it standing up, and then putting it on the floor and rolling it for 15-20 minutes every evening. Number 3, I recommend getting a night splint, which is a device that's going to help provide a passive stretch of the Achilles and plantar fascia. You use this when you go to sleep in the evening. Number 4 would be to try a topical anti-inflammatory such as Tiger Balm or Icy Hot, and applying it to the arch every evening. And in more severe cases, you could take ibuprofen to help reduce some of the inflammation and pain associated with plantar fasciitis. Number 5, I would recommend getting a prefabricated orthotic such as the Power Step or the Dr. Scholl's. More appropriately, I would recommend getting a custom orthotic that you could have made in the office by a foot specialist who will take a laser scan impression of your foot to make a customized insert that you can put from shoe to shoe. And then the 6th tip would be, when all of these other tips fail, to go to a foot and ankle specialist to have a proper foot evaluation and management that could also involve getting x-rays and treatment that could either consist of passive and also active physical therapy, as well as shockwave treatment, which can reduce the symptoms in 95% of the patients. Sometimes a cortisone injection may be offered, and in chronic cases of plantar fasciitis, there's a simple, minimally invasive procedure that can clean the scar tissue under ultrasound called 10X, and this can be done in conjunction with PRP injections and amnio injections. PRP is where we take 10 cc's of your blood, we spin it down, we get the growth factors, and we inject it into the areas of maximal tenderness, and this provides tremendous results in resolving plantar fasciitis pain.